All right. Welcome once again to everybody who's joining today's webinar with SIIM. I'm super excited to be talking about today's topic, which is integration. So the official, topic of today's webinar is integration elevation, how to transform your daily workflows. I know this is something I in particular feel really passionate about. I love having conversations about the opportunity that lies within integrations, and I'm incredibly excited about the panelists that we have on board. Just a couple of quick logistics before we get started. We will be saving time at the end for Q&A, and we always love to hear from you. Our audience always has such great questions. So if you do have questions, please submit them into the Q&A box that is within the Zoom window, and we'll be sure to save time for those at the end of the content today. I could not be more excited to introduce our panelists for today. I want to briefly kind of let you know who they are. We will be circling back so that they can give you an introduction from their perspective about the providers that they're affiliated with and their roles at those providers. But we are joined today by Jennifer Van Cleve from Honor Health and Andrew Longoria from CHOP, the Children's Hospital of Philadelphia. I'll let them introduce themselves in just a second. My name is Chantel Hopper. I am the VP of Customer Success at Umbra Health. I'm super excited to be moderating the panel today, and I know it's just going to be an incredibly rich discussion, and we're going to learn a lot. Before we dive into the panel, I did just want to set the stage slightly for what we're going to be talking about. So really big picture, EHR systems are something we talk about all the time. Our providers across the country, across the world, are making massive investments in these systems, whether it's Epic or Cerner or Athena. And really the goal is to capture and standardize patient data for the organization at large and having it all in sort of one place. We talk a lot about the holistic patient record and the value that creates for a system. So that's sort of one part of the piece we're going to be talking about today. And then, of course, just given, who Umbra Health is and the folks that we have online today, imaging is a huge piece of patient data and being a part of that holistic patient health record, as it's a really crucial piece of information in terms of patient care. So historically, I think imaging has really lived outside of the EHRs, right? And I like to think about sort of the data management, both at EHRs and with imaging in three different buckets, right? There's first the intake piece, right? So getting information from patients and referring providers inclusive of imaging. There's the access piece. So when the information is available on site, who is accessing it and how? And then finally, you have the distribution piece. So how do we share out that information, whether it's the patient health information or the imaging? And when we think about imaging as a whole, along those three dimensions and historically what that's looked like, really on the intake piece, historically, and we talk about it all the time, getting imaging into a provider has been very dependent on CDs. Whether that's a CD that's mailed in from another provider or a CD that is uploaded on site at the time of the appointment. And we all know the challenges there, right? CDs can be broken, they can be completely unavailable, which is often the case. And also there's sort of stickiness in there and sort of time to PACS, right? And thinking about how long it's actually going to take to fix up the information for the patient to match the system's records before it gets to PACS. In terms of the access piece, so people on site being able to view imaging, I mean, PACS systems are available, but typically it's not necessarily available to everybody at the organization or to all providers to be able to view prior patient imaging and imaging taken on site. And then finally, with the distribution or the sharing piece, we're sort of back to CDs there, right? In terms of getting imaging out to patients and or referring providers, the historic or the traditional process is really to burn a CD, to fax a report, which obviously places a big burden on the staff, is very inefficient, and there are a ton of added costs there. So what we're seeing recently, which is really exciting to me, is this trend where providers are looking at their outside and internal cloud-based image management systems and actually working to integrate those into their EHRs, right? As a way to maximize the investments that they're making in these EHRs because we know that they're immense, provide a better experience for patients and end users, which is, your clinical staff, your administrators, your referring provider population, right? In terms of leveraging existing portals to do some of these activities. And then ultimately all of this really aiming towards providing better patient care. So today, that's really the framework we're going to work through. We're going to talk about image intake, historical challenges and opportunities brought forth through integrating upload and transfer solutions into EHR data. We're going to talk about viewing, so opportunities in enabling clinicians and staff to view imaging directly from the EHR as a result of a universal viewer. And then finally, access. So how do you leverage patient and referring physician portals to actually electronically distribute imaging and reports, which in turn is going to make things a lot more efficient. So that's really going to be the framework that we work through today. As I mentioned before, we've got two incredible panelists online today that I could not be more thrilled are going to be talking through how they've worked through some of these challenges and taken advantage of the opportunities available through integrating. So first, I would like to introduce Jennifer Van Cleve, who has graciously agreed to still be a panelist despite feeling under the weather. Jennifer, thank you so much for joining us. Do you mind just giving us a brief overview of who you are and what your role is at Honor Health?
Good morning. Thank you. Yes, Jennifer Van Cleve. I am the IT Applications Manager at Honor Health. I am responsible for a few of our application teams, so Radiant, Optime, Cupid, and our PACS team. And I've worked at Honor Health for 19 years.
Wow. Well, thank you again, Jennifer, for joining. Andrew Longoria is on with us from the Children's Hospital of Philadelphia. Andrew, do you mind giving us a brief introduction of yourself?
Hi, Andrew Longoria with the Children's Hospital of Philadelphia. My team is over radiology informatics and PACS, and that includes everything from the imaging, dictations, reporting, as well as all the workflow, and then the internal, external integrations with other facilities for second opinions, referrals, and teleradiology.
Awesome. So given both of your experience combined and what you oversee, I have no doubt that we're going to have a pretty colorful discussion today. So with that, I'm going to go ahead and dive right into it. As I mentioned before, the first thing that we're going to go through is patient data and imaging making the match. So really really thinking about image intake, the challenges that have sort of been presented through the traditional methods and ways that those challenges could be overcome and or optimized through some of the integrations. Our first question, and Andrew, I'll start with you on this one. Combining patient imaging and data can be a burdensome challenge. Patient imaging coming from inside out or from outside in is not going to have the same patient information. So there's reconciliation that needs to happen. And also it's just not readily available. I'd love to hear about what some of the workarounds your facility has put in place to combine imaging with the patient records and sort of maybe an acknowledgement of the challenges as well. And then we'll sort of save the second part of this question for after that.
Well, I think for us, we're still, I hate to say it, relying upon a lot of DVDs, for the imaging. There's still faxing going on. So we have multiple projects and efforts in place to help streamline those approaches. I think for imaging, which is my expertise, for us, it was, we were thinking as we looked at the imaging on the DVDs, how do we eliminate it internally and externally? And so to start externally coming in, we looked at the whole large scope of all imaging coming in across all departments, and we found it was easier just to focus on one department at a time or one workflow at a time. So we started with our trauma and transport. That was a really contained group within like the ED, and it wasn't such a big scope of people. And that we thought we'd try to find a good workflow for that and then apply it to the rest of the organization.
Interesting.
And then for outbound, and we'll talk about this in a little bit. We felt the best way was to image enable, the patient portal, and that was our next step, which we're working on right now.
Awesome. You mentioned trauma because I think it's a really specific and an important workflow that many facilities face. Can you talk to me about what you were doing in terms of image intake on the trauma side of things prior to enabling a sort of integrated solution? And then do you mind talking about a little bit more about the solution that you implemented?
Sure. So, if the trauma patient comes in, there's a lot of teams that are involved. A lot of communication needs to happen so that they know where the imaging's at. Mm-hmm. As it is the old way, the patient just shows up with a DVD and a paper record on their cart wheeled in with them. And hopefully that DVD has all the imaging. Hopefully it's not a corrupt DVD, and hopefully it's the right patient. So right. That's many issues that I know many of us have all encountered. So what we've been working on is working with partner facilities, within our region to enable us to connect electronically so that we can get the imaging even before the patient arrives. That's our goal, is so that we can even triage before the patient arrives at the hospital. Maybe they don't even need to come at all. So that's our end goal. And so it's taking a lot of communication with partner facilities, but internally, we're also putting in questions within the EMR, where when the transport team takes in the patient information, there's a whole section about just imaging, which is then communicated down the line to our reading room assistants as well, who manage our image sharing.
Can you give a couple examples of what sort of information you're capturing in the EMR related to imaging?
It's very basic. It's
Okay.
just asking if the imaging has been sent. It really isn't too complex. We just wanted to make it as easy as possible. And
Right.
then when the patient does arrive, we also have a mechanism internally to notify all of the teams involved, about the patient coming. But for that one team for imaging, it would be the reading room assistants who are notified so that they can begin working on the imaging that's coming inbound electronically.
Awesome. And I guess since implementing the solution, what sort of results have you seen? What were the, intended results that you were hoping to achieve through implementing this sort of workflow? And have you seen them?
We have. It's very early on. It's been a challenging process, but the goal, like I said before, was have the imaging before the patient arrives, and that's just now starting to happen. And that just makes the treatment of care of these patients so much quicker and efficient. And sometimes we've identified patients don't need to be transferred at all, and that's the goal.
Right. Super interesting. Jennifer, I want to turn it over to you. Honor Health, what are some of the challenges you guys have faced in terms of getting imaging in, combining or consolidating the other data around a patient with the imaging, and then what have you guys done to sort of overcome those challenges?
I think that our biggest challenge right now is still the amount of CD burning that not only we get, but we're still sending out. And which is pretty interesting because I'm not exactly sure what computers these days actually have CD readers on them. So
mine doesn't.
Trying to figure out like where people are putting these CDs is mind-boggling to me. But I think one of the ways that we've helped overcome this for sure is increasing the amount of gateways that we have with other customers. We've done a lot of integration with Umbra and our EHR, which I think has drastically helped with this as well. Our patient portal is integrated with Umbra, so patients can serve themselves and retrieve their imaging and share them, which I think has been extremely helpful. And our file room staff is really good at getting imaging and reaching out to patients to find out where their imaging was done and then requesting those images via the Umbra gateway. But I think for sure the work in progress, and I'm not sure how to overcome this, is just the CD burning. And I think it's kind of similar to when we went from film to CD. It was really hard to get away from doing film, and it was a continuous work in progress. And I think we're headed in the right direction. It's just taking a little bit longer to wean the CD burning away.
Yeah. One thing that both of you alluded to, but we haven't talked about explicitly, which I do think is a challenge for the intake piece, right? There's the medium in which the imaging is coming in. You guys both mentioned CDs as being still, I think, probably the biggest headache creator. But even once the CD is on site and it works and you can get the imaging off of it, there's this other piece of, or presumably wanting or needing to clean up, right? Associate that imaging with an order. Associate that imaging with a patient, with the patient as the patient is recorded in your own system. So this whole big piece of actually fixing up the information around the imaging, creating an outside order before it sort of then lives in your own on-site systems. I guess, Andrew, I'll go back to you. Is this a challenge that you guys see, sort of that time to fix up? And then if so, how have you guys addressed it? And then we'll start with Andrew and then we'll go to Jennifer.
Can I go back to a challenge real quick?
For sure.
Okay, so I think another challenge we also experience is all of the multiple image sharing vendors in the industry, and that's probably number two challenge, is just that everybody has their own vendor and they want to use that vendor because, as you talk about here, this question, the internal workflows that are built around that system, right? And so that's taken a lot of agreements with other sites for us, at least, to agree, like, we'll use yours, you use ours, and it's a challenge, right. It'd be nice if we all could talk to one another, if I have AT&T and somebody has Verizon, we can still call each other on through the same phone. So it'd be nice to have that. That was a challenge I wanted to throw out there.
No, I appreciate that.
Yeah, but back to your question, and what was the question?
Really around PHI fix-up, right? You have the imaging, it's there, but the patient's data is presumably from an outside facility.
Right.
There is not an order created. How do you, what does that look like today? And have you implemented any workflows to make that process more efficient?
Right. Yeah, I mean, for most sites, that takes a whole FTE and probably more just to manage that workflow, matching orders with imaging. Thankfully, with our last upgrade to our image sharing software, we were able to standardize through the AutoFilm library, which basically allows us to automate that process where the orders are created when the imaging is uploaded. And that's was a big win for us, because I know a lot of sites deal with a long turnaround time to get imaging into their packs, matched with an order. It takes a while. And so for us, it's been nice is we've integrated in with our EMR so that, the non-radiology clinicians and medical staff can upload, and it goes basically straight to PACS while creating an automatic, an ORU message or an order message going to our EMR to match up with the imaging, which just has been fantastic.
Right. So actually enabling, first of all, you're enabling a broader population to actually upload CDs, right? Because it's the upload tool is available within the EHR. And then because you're uploading through the EHR, you have that patient context. And so it's able to automatically create the orders and apply the information prior to sending down to PACS. Right.
Being within Epic, in the patient chart, that context is all there. And that process just goes through seamlessly. It's great. And it's also reducing the demand on our other reading room assistants who manage our image sharing, so they can work on other parts of their job.
Right. They get to shift on potentially higher priority or higher urgency issues versus just the kind of standard routine fix up of I have a CD with no context and I have to match it.
Exactly.
No, I love that workflow. I think it's fantastic. It's really both in terms of allowing more people within your organization to take ownership in the uploading process and not just a limited file room, but then also taking that information to auto generate the order, update the PHI and get it into PACS. You see a hugely reduced time of imaging from when it's presented on site to being available for clinicians, which obviously is fantastic for patient care. That's great. Jennifer, I'll turn it over to you. PHI fix up and reconciliation. Can you talk to me a little bit about what you're doing at Honor Health?
Yes. First, I would like to second what Andrew said about his challenge with a vendor. So yes, it's a challenge I think that we all experience, but our workflow is pretty similar or right on actually to what he mentioned. So with our integration with our EHR, we can ingest the images and it also generates an order on the back end. Predominantly our file room staff is the one that performs this workflow. However, we have the option for pretty much everyone to be able to do it. However, they have to have a CD reader on their computer. So none of our computers really have CD readers. So if it's an area that's going to be ingesting CDs, mostly in the EDs, I think some of the ORs do it. So we have to get CD readers for those. But pretty much anyone can ingest a CD, generates an order, and goes to PACS. So very seamless workflow, pretty similar to what he mentioned as well.
Awesome. That was great. I'm going to go ahead and jump to the next question because I think talking about an end solution is one thing, but talking about the evaluation process, especially for people who might be listening in who have not implemented these workflows, is also really valuable as well. So kind of rewind back to when you were evaluating a new image management vendor or strategy and just thinking about how it would be interoperable and communicate with others. Was this a priority for you all when you were sort of evaluating a cloud image management vendor? And then sort of what was the approach that your organization took here? Really just thinking about, I guess, the value of interoperability of your systems with others as being a component in any sort of structured eval process. Jennifer, why don't we start this one with you?
Sure. So when we were doing vendor selection, first and foremost, we wanted to make sure that it integrated well with our EHR, image sharing and cloud imaging. Integrating with the EHR is super important. And then the other thing we wanted to make sure was that it was friendly for our customers. We wanted to make sure that they could use it, they could retrieve images, and how it integrated for them, and we wanted to make it as easy and seamless as possible for not only for them to upload images, but to share images, with their family, with their physicians, and just make it as easy and as streamlined as possible. So making sure that it integrated with our EHR and that it was really user-friendly for our customers were our two main things that we were looking for when we were doing our vendor selection.
Yeah. The term customer to me is so interesting in this space. I think about it often, right? Because I think about the sort of customers that we serve. I guess to sort of, when you're saying customers, I'm imagining that you're really referring to any end user of the platform, right? So that could be your patients, it could be your referring physicians. Can you talk to me a little bit more how you guys think about your customers, your different stakeholders, and kind of serving their needs?
Yeah, so when I'm saying customers, I'm meaning really anyone using the application. That could be our patients, that could be our referring providers. Is it easy for them to send images and retrieve images? Our hospital employees, we want to make it easy for them to be able to upload images and to send images if another organization is asking for. So really, we wanted to make it as simple and streamlined, as integrated as possible for whomever was using it.
Awesome. Andrew, I'll turn it over to you.
I think the same for us. I mean, as we looked at a new, vendor to fill this space, we looked at something that was intuitive and something that was, I think, like Jennifer just said, I think just integrating with the EMR, patient portal, all of our end users, all our customers. But I think for us, we even started an enterprise imaging assessment, 5 years ago. And at that point, we realized how much outside imaging was coming in. We didn't really have a grasp of how much our different departments were utilizing outside imaging. And a lot of it wasn't even going into the medical record or into PACS. So we've been thinking about this for quite some time. And then also looking at, growing. I think also for us, we wanted to grow utilization of our patient portal. I know it's another question we have later. But that was also a big driver to make sure we had better integration with our patient portal or EMR as well.
Yeah. You both have mentioned patients as being end users and or customers, which I think is spot on. Given that we're in the intake piece, and I think how and from whom imaging comes into an organization is very varied. Andrew, I think to your point, it's coming in from everywhere, from a lot of different people. Do you guys have the ability for patients to upload their imaging prior to coming on site? Yes or no? What does that look like? I guess, Andrew, is that available today at CHOP? I know it's a children's hospital, so obviously a little bit nuanced, but I'd love to hear a little bit about that from both of you.
Yeah. We have integration with our patient portal for patients to upload.
Awesome.
We have links off of our websites, off of departmental websites. It's pretty straightforward. And being a pediatric hospital, our parents are younger, typically younger, so they're more tech savvy. It's not as challenging. I do meet with different departments, and different departments will have adopted this better than others because they've focused on it. So, areas that have a lot more imaging, like in oncology, will really have someone really working with their patients to get the imaging before their patient visits. So there's some departments that do it incredibly well, and they'll have all of their patients imaging before they even come for their visit, which streamlines their appointments.
Probably also nice to have it departmentally based, right? That the upload process and or any questions, et cetera, can be specified to the department and what the needs are of those physicians prior to having the patient come in. And I love that you mentioned uploading via the patient portal. I think when we hear about patient portals, we immediately jump to, patient portals are for the access piece, right? To get my imaging, to get my reports, versus the intake piece, which I think that there's just immense value in putting that into the patient's hands, because you sort of guarantee you have that imaging prior to the appointment, ready to go. Jennifer, I'll turn it over to you. Are patients uploading? How do you sort of have that structured at Honor Health?
Yep, pretty much exactly the same. They have that same ability on the patient portal as well. I don't think we have anything on our website, but I think that's a great idea. We really try to push people towards our patient portal to increase not only the adoption, but to empower them to be able to upload images or download images or share images. But yeah, I definitely do like the idea of putting it on the website as well as a secondary option.
Of course. Now,
I think
go
for
ahead,
us,
Andrew.
I think for us, we're trying to also follow online scheduling. So as patients are scheduling their radiology exams, that's either through the patient portal or through the website. So we're trying to put imaging uploading in the same locations so they can kind of tie those together.
Yeah, and I think that's part of this
that
whole
makes sense.
Integrated message, right? Put everything in one place that patients aren't hopping around to different links or portals, et cetera, to get you all the information and to perform the actions prior to an appointment that they need to.
Right, and I think for us, everything is in the patient portal. So the way you have it set up, having it on both actually does make sense to upload images on either the patient portal or on the website.
Awesome. All right, final question for the intake piece, and then we'll move on. It sort of speaks to a little bit of the one of the big challenges, or I guess we're calling it challenge number 2, that we talked about a few minutes ago. What are the biggest barriers to interoperability? And I want to add a barrier here that you guys have both discussed, and how did you overcome them? I want to talk about interoperability as being a challenge. I also want to talk about end user adoption of these solutions as being maybe a second barrier, and just hearing how you guys have gone about overcoming each of those. Jennifer, why don't we start with you on this question? Biggest barriers you've overcome, or you've encountered, and how you've overcome them on the intake side of things, on getting imaging in.
Right. Yeah. I don't know if we've necessarily overcome it. I still think it's a work in progress for sure. Yeah. Right. Yes. Yeah. It's like we discussed earlier, just the multiple vendors and trying to get everyone to share images regardless of what platform. I mean, ultimately, we want to make sure that we can share images with each other regardless of what vendor. This is a patient care thing. So when we're transferring patients to other hospitals, we want to make sure we get imaging sent over regardless of how we're doing that. So I don't think we've overcome it. So definitely a work in progress. I think if we're not able to share images with other organizations, so for example, our hospital isn't a huge pediatric organization, so we do send a lot of pediatric patients to another organization. So if we're not able to send images to them, using the cloud-based solution, we still, have to obviously do a CD. Like I said, most importantly, it's getting that imaging over so they're not being rescanned or re-imaged. So definitely something that we're still working on. Was there a second part of that question that I missed?
I sort of presented adoption of these. I mean, you guys have both implemented some pretty incredible solutions to get imaging in. What are some barriers with adoption you've encountered?
Honestly, I think just getting patients off of I need a CD when they come into, the HIM department. And I think now that we've integrated it with our patient portal, that adoption has gone up immensely. Mm-hmm. I noticed the patient portal adoption went up a lot when, of course, when COVID was at its worst and we were setting up vaccine clinics and doing all that. So we really geared and drove people towards the patient portal. And now that we've integrated Umbra with that as our cloud solution, it's even increased adoption even more. So I think really just trying to wean and continuing to wean off the CDs and driving patients and customers to the portal is the way to really overcome it.
Yeah, it's interesting because it almost seems like the barrier was how disparate these systems were. One of the ways to overcome it is the integration, right? To integrate the upload process with the patient portal. So sort of a chicken or egg there. Right. Andrew, any additional comments on just barriers you've encountered on the image intake piece, and maybe not how you overcame them, but how you're working to overcome them?
I think when I thinking back to like 2014 or around there, when I first started, digging into image sharing, there was a lot of sites that were really resistant to use any kind of cloud image sharing because of security concerns, and it's very interesting to see how that's transitioned since then, over the last 7 years, and now pretty much you don't have any problem exchanging electronic with really anybody. That comes down to, again, like I said before, your vendor versus their vendor. That's kind of the interoperability problems that we have. Right. But we've actually, we've been able to find ways to make that work internally. I think, like she said, as long as you're integrated with your EMR is your source of truth for all of your, patient access, medicine, imaging, reporting. So if you can integrate with that tightly, then you'll be successful. And that's what we've seen.
That's awesome. All right, we're going to move on to the next part of this. Oh, go ahead, Jennifer.
No, just a quick comment. He mentioned just the adoption of, I think, other organizations. And I noticed that too. It was really hard for some of our smaller physician practices to adopt the whole cloud image sharing thing. They were still requesting CDs, and we have a PACS admin that provides a lot of education around the cloud imaging, and leveraging him to help educate our smaller practices really helped for them to understand, how much quicker this was, how much easier it was, and it's been extremely helpful.
Yeah, I love this idea of not even idea. I love the emphasis on education in rolling out new systems. I think it's so important, right? Your technology is only as good as the people who are empowered to use it. And that both means your internal staff and stakeholders, as well as your external customers, as we just discussed. And so I think it's a very worthwhile effort to not just educate on workflows, but also, it sounds like, Jennifer, you're sort of going above and beyond and educating on why you're choosing to pick certain systems or solutions for certain workflows and how that's going to be beneficial for the end user, which I think goes a really long way in encouraging adoption.
Right. Agreed.
Awesome. All right. So next section is around image viewing. So the images are they're in your PACS, and now your clinicians, your staff, your administrators, being able to see the imaging from within the EHR is a huge trend that I'm seeing across our customers working to implement and or think about. So the first question here is really around a universal image viewing strategy. We're hearing a lot about universal viewers and the merits of them. Obviously, I think it's an emerging idea here. Universal viewing strategy can speed up time to care delivery for patients. Are you guys looking to implement a more streamlined method of sort of bringing the imaging into the patient jacket? I guess I'll start there. Are you guys looking into providing a universal viewing strategy? Is the EHR patient jacket involved in that strategy? Andrew, why don't we start with you this time?
Yeah, like I said, the EMR being the source of truth, I think that's, for us, was key. So tying the imaging to that was important, not only for our physicians, but for our patients. And actually, to even think about it too, it's not just, there's the EMR, and then there's like the outside EMR. So that's two pieces that we've had to address, because the outside EMR is not on staff physicians. And so we also had to image enable that as well for them, because they don't have access to our main EMR. But I think overall, for us, it was everywhere that a physician or clinician would need imaging, we wanted to support that. We wanted to eliminate any kind of texting of imaging or any non-HIPAA compliant types of image sharing. So really, we've found is there's also mobile EMR that we've also started integrating into as well. So that's been key for us. We just implemented it not too long ago, and have seen a great growth and use of it. And again, back to the patient portal, since we've image enabled it, didn't really advertise it, and it just grew like crazy. It just people just are really quick to adopt stuff like that.
I love that comment on basically anywhere the physician is, you want them to be able to view imaging. And then the second part of that is in a compliant way, and making sure that imaging is available in a HIPAA compliant. And by bringing that into the EMR, to the EHR, whether it's your inside or your outside EMR, you are guaranteeing that, right? Imaging is being surfaced that is for that patient. You're able to restrict access of viewing that imaging in a very auditable way, right? Because you know who's accessing the patient record and the imaging in addition to that. So I know we mentioned time savings here as being a value add, but are there what have you seen as the other sort of like key benefits, key value adds of that integration of imaging into the EHR?
That's me still, or Jennifer?
Oh, sorry, Andrew, I'll stick with you and then I'll do the whole question for Jennifer. I was not specific there. I apologize.
That's okay. So yeah, I think, again, time savings. And then for us, we're a teaching hospital. So it's actually more supporting a teaching environment. So we have attendings working with residents and fellows, and they're not, and again, with COVID, they're not all in the same place at the same time. So this has been very helpful for them to still be able to, work with their trainees, even though they're not physically in the same location. It's been really big for us. It's been very helpful.
That's awesome. Yeah. I feel like I'm trying to stay away from asking about how COVID has impacted all this, as it seems to be a common question I ask, but you're right. It's very true. It's COVID and the pandemic has created a much more remote environment than existed before, and sort of surfaced a whole new series of challenges that I think has, for me, what I've witnessed is increased the momentum for people wanting to implement these sort of strategies, which has been exciting to see. Jennifer, I'll turn the whole question over to you. Are you looking for a more streamlined method of sort of integrating imaging into the patient record? And if that has been implemented, what sort of benefits are you seeing so far?
So similar to what Andrew said, our EHR is also our source of truth for everything. So when an imaging is performed, we have image links that show up in our result report. So all of our images are accessible in the EHR. Very few providers have to actually log into a PAC system separately to view images.
Awesome.
We don't really have necessarily a universal viewer, but that's kind of how most of our images are viewed, is from within the EHR.
That's awesome. And since
which is super streamlined, I think, yes.
Yeah, I was going to say, so, I mean, I love the word streamlined because it really, I think, characterizes what this integration can do. But what sort of benefits, have you noticed on site at Honor Health from that sort of integrated data, right? Putting the imaging alongside the other patient data.
It's been a huge physician satisfier, because now they don't have to log into multiple applications to view images. It passes, when they're logged into the EHR and they click on the image link, it passes their credentials, so they don't have to log in again. It launches that exact image and report that they're wanting to look at. So it's just been a huge physician satisfier, because nobody wants to log into multiple applications.
No, and physician satisfaction is extremely, extremely important. I, as someone who works at a vendor, I am fully aware of the vendor fatigue phenomenon that exists out there. And so I think the more we can keep people in one portal or through one login or accessing through one streamlined system, the better for everybody, because at the end of the day, it saves time, it saves frustration. And so, especially in the case of your physicians, they can really focus on what they're there to do, which is patient care, right? They're not worried about their password. We don't want them worried about their password.
Right. It's much more efficient, and it saves clicks, which they know how many clicks everything takes. And so yes, anything we can do to save clicks and make the workflow more efficient, we're all about.
I hear you, and I'm taking notes, Jennifer. Before I move on from this question, anything else that either of you want to add to sort of universal image viewing strategy? I think we have one more question in the viewing section, but anything before I move on? All right, let's move on. All right, referring physicians. So you guys have talked about your own physicians internally. I think there's been mentions of referring physicians, but as we discussed in the first section, referring physicians are pretty critical to a large healthcare facilities network, right? I really do think of them as one of the customers in a way of a big health system like the ones that you both work at. How right now are referring physicians able to view patient data within your facility, and are integrated systems a component to that relationship? Jennifer, let's start with you.
Sure. So a lot of our referring providers, or at least providers that refer a lot to our organization, have or can have a view-only version of our EHR, where they're able to see some patient information, view some labs, view some imaging, so they can access images using that. We also do, have to send CDs over, or, fax results. But I think a lot of our providers that refer a lot to us are using the view-only version of our EHR, which allows them to still view imaging.
Got it.
From within their office. And again, they can receive fax, not images, but result reports also.
Awesome. What have you seen sort of is adoption good there? Satisfaction, et cetera. Do you have those sort of feedback loops in place to sort of get a sense of how they're enjoying these systems?
Yep. And we're also, part of our PAC admin's responsibility too is to provide some education to these providers, also letting them know about, cloud sharing and image sharing and how it works, and, how we can send a link. And if, a lot of our orthopedic offices, want to send imaging over, and we provide education either with him or with our front office staff on how they can send them via Umbra or, CD. Of course, we try not to mention the CD burning, as we do that as little as possible. We definitely want them doing the cloud sharing, because it's so much easier. But, we still do have those offices that very much want to send a CD or receive a CD.
Of course. And I mean, that's a common thread that I've heard from both of you today is you can have one system, but at the end of the day, you have to have workflows that accommodate all of your end users. So it's almost like it's not 100% in one. It's sort of, you want to shift as much as possible to the most integrated, streamlined system, while also making sure that the mechanisms and workflows are available for people who have not yet adopted that. And then, Jennifer, to your continued point, which I love and is resonating with me, how can we use education to bridge that gap of the people who have not yet adopted or feel comfortable with the newer way of doing things, which I think is so important.
Yeah. It is important because they don't know what they don't know. And exactly. The only way to keep increasing adoption is to provide education. And that's something that we're really passionate about is, providing education ongoing.
You are speaking my language. I love it. Andrew, I'll turn this question over to you. Referring physicians, how are they accessing data and imaging from CHOP today? And then our integrated systems a part of that?
Yeah, like I said before, they're going, if they're on staff, they're going through our EMR integration. If they're not on staff, we have our EMR vendor provides a not on staff, like light version, kind of more of a read only, like Jennifer talked about. I think for us, the key is being intuitive and easy to use. So our international medicine actually heavily uses our, Umbra application. So for them, it was, they're dealing with, patients all over the world, different languages, and the key was to be intuitive, and that's been successful for us so far.
Yeah, and I think that as a technology provider, as a vendor, it's really just not about, the reality is not just about functionality. The functionality can be there, but if it's not easy to use, if it's not intuitive, it's not going to be used by people. And so I think it's really important to keep that in mind, both as a vendor and as a provider, in terms of the systems that you are administering and providing to your end users, and how to continue to both improve on the usability and intuitiveness while simultaneously continuing to educate people to make them more comfortable. Awesome. All right. I'm, keeping an eye on the clock here, and we've already got some really good questions coming in. So I'm going to jump to our third section of today, which is about patient access. I could talk about this for an entire webinar, but we're going to boil it down to the last 10 minutes. A little of this, I know we were I think all of us might feel the same way, because we've been kind of jumping towards patient imaging and report access via the patient portal. So I'm excited to spend some time dedicated to talking about that. I guess I spoke too soon. We've got a COVID specific framed question here. The COVID-19 pandemic has ushered in a huge push for increased patient access. How have you guys met this demand? Has integrating imaging within your patient portal been a key piece of the puzzle? I think both of you have acknowledged that, yes, in fact, that has been a huge part of your strategy. Yes, COVID-19 has increased maybe adoption, or maybe that adoption is driven by need. Maybe it has just been driven by the fact that it's integrated. But maybe I can frame this a little bit as, tell me the story of, and Andrew, I'll start with you on this one. Tell me the story of CHOP Image enables their patient portal. What did that look like? What has the response and the adoption been there? And what is the feedback been?
Well, I think for us, we shifted a lot of our patient visits to telehealth, so that this was really important for them to be able to get that imaging along with those virtual visits.
Right.
So that lined up perfectly. I think, patients just not wanting to come into the hospital. They weren't, that especially during early COVID, they were not comfortable. So this was just another way for them to send imaging in and allow them to, peace of mind. And then on the flip side too, also to get their imaging, same thing. So it just allowed them to virtually get what they needed completed, while not going on site.
I think one challenge I've heard from providers when evaluating whether or not to implement a patient portal is the question of, well, I burn about this many CDs today for patients. Is there really going to be demand? What have you seen in terms of demand?
Yeah, I think that's just now that it's available. People like to, people want to own their medical records, and that's, it's them, it's their property. So I think this allows them to feel more comfortable with getting that imaging. They feel more, I think, engaged within their care, right? So especially in the patient portal, they can see their labs, they can see their imaging, all that's together, and they become more active in their own health or their child's health.
Right. I would be curious if you tracked it, what was the increase or decrease, or did it stay the same in terms of a percentage of your patients that were requesting CDs via that medium versus when you shifted to an electronic portal? Was there a jump in terms of the amount of imaging that was being accessed by, was there a jump in the amount of patients who were actually accessing this imaging?
If you're just comparing the just side to side numbers, it's probably tenfold. I mean, it's a lot more. I can't say that all those people were actually going to get DVDs. That's hard to determine.
Right.
We're just basically trying to, like Jennifer said earlier, like we did with film going into CDs, we want to see, of course, the DVD CDs go down while image, patient portal access goes up. That's our goal.
And have you seen that? Does your facility still burn CDs or DVDs?
Yeah.
And have you noticed a decrease because of the patient portal or the availability via the patient portal?
It's going down, but that's kind of an effort we're working on right now. I think that really involves educating all of the people within the department, like the radiology technologists, the front desk staff registration. They all have to be, educated on that this is available.
Right.
They're all pretty aware of patient portal access, but the imaging's available there and how to access it and use it is more, I think, a little more education that's needed.
Yeah. And I think we're going to get to that. I want to dig into the education and sort of marketing question in the second question a bit. Before I do that, Jennifer, I'm going to flip over to you. Talk to me about what is your story been at Honor Health around image enabling the patient portal?
Oh my gosh, I could literally talk about this all day long also. I think, since the COVID pandemic, everything really shifted to virtual and mobile and, virtual visits and, everyone trying to schedule appointments using their patient portal. So I think the pandemic did really quickly, shift patients and shift people to using the portals more often for everything. Mm-hmm. And for sure, when we set up our integration with our imaging and patient portal, our adoption has gone up immensely. So I think, over the last couple of years, we were hovering on our adoption around our patient portal in the high 20s, low 30%. And last I heard, we were over 60%.
Wow.
And I can see, I know, it's crazy. And I see an incline of patients accessing their images, downloading their images, sharing their images. So I think the more we can keep patients engaged and empowered and using the patient portal, the more adoption is going to go up. Because we definitely don't want, now that I don't want to say COVID is slowing down, but I definitely don't want to lose momentum on, getting them to using the patient portal. So trying to keep them engaged and having imaging there has been a huge satisfier.
Right. And I think there's attribution there. I know you mentioned COVID as being a big primary driver of increasing that adoption of your patient portal. Is there a part of you that thinks putting the imaging there also served as a driver of adoption? Maybe somebody who wasn't previously accessing the patient portal, but now that their imaging is there is saying, yeah, actually now I want to log in. What is your sense there?
Yep. So when patients call like our HIM department or our radiology front desk asking for images, the first thing we tell them is, oh, you can view your images, from your patient portal. And, we even try to walk them through on how to access it. We have tip sheets on how, they can access it in there. So we really try to steer them. We don't want patients really coming into the hospital and get a CD, if, especially now more than ever, if they don't have to.
Right.
A lot of them may not know imaging is there. I actually had a chest x-ray today, logged into my patient portal, and I was able to view my images. I had never ever tried it before, so that was kind of cool. So the more we can try to get people using it, the better. And like I said, I think the imaging for sure has helped with the adoption piece.
That's awesome. All right, final question, and then we're going to get into some questions from our attendees today. Facilities often complain that patients don't use their patient portal or that they're worried they won't use it. How are you guys educating and encouraging patients to use these tools? I think each of you have mentioned a little bit, but I'd like to dive a little bit deeper. Jennifer, you mentioned tip sheets, education, et cetera. What are some really tangible, actionable methods that Honor Health is doing to educate their patients around imaging being in the patient portal?
So when patients are discharged from either the hospital or you go in and, to one of our urgent cares or ambulatory sites, we get discharge instructions printed out. And the first thing that's on there is your patient portal, how to access it. Mm-hmm. I don't know if there's specific education around imaging being there, although they do tell me, and they did tell me this today, that, if you want to, access your report, you can access it through, your portal, and you'll probably get the result before I even have time to call you.
Right.
But I think we need to do better about also letting the patients know that not only the report is going to be there, that their images will be there, even if they don't know how to read them, and then most won't know how to read them, but at least they have the ability to look at them, share them with somebody, share them with, their primary care or whomever they want.
Right.
So I think we could definitely do better about calling out images specifically and not just the report.
Yeah, and you mentioned something that I think is really key when we're talking about patient portals is viewing is one component of a patient portal, but the ability to share and to download imaging is of immense value to your patients because the majority of your patients, dare I say about 99%, are not going to be able to do anything if all they can do is view their imaging, right? They don't, and maybe it's cool to look at, right? If you have a broken bone, that's awesome. You want to see that. But the real value there for the patients is their ability to then share that imaging at other points of their care, should they be inclined to do so. And I think that that goes back to Andrew's comment around ownership of the data, which is so important, with these integrated systems. So for that, I guess, Andrew, I'll turn it over to you. Anything, education, encouraging patients to use these tools. What are you guys doing at CHOP?
Like I said, that's kind of where we're in the process of right now, I think. But as a hospital, just looking to grow utilization of the patient portal, adding imaging will just grow it significantly because most people have imaging and it's very visual. It's very visual. That's something that they like to look at. Like, yeah, but you definitely have that extra functionality to actually share it and download it are the key pieces that they actually need. Right. As a patient.
Right. It's good for the patient. It's good for your staff as well, because later on down the line, if that patient has to go somewhere else, they're not calling you guys and saying, I need this imaging sent or I need it burned. The patient can actually do that themselves. So I think the benefits of this integration of data into the EHR is not just a day after, a week after, but it's sort of the value continues to be created as we get further in time, further away from the actual patient visit. All right, this has been awesome. I'm going to jump into some questions because there are some really good ones. I know that we've answered a couple in the bot, but I do want to talk about some of them verbally because I think it's worthwhile. So this is going back to that image intake piece. You mentioned that orders are auto-generated when outside exams are uploaded or brought into PACS. What prevents current orders from being generated when a current exam is uploaded? What's the trigger or filter that tells the system, yes, create an order for the exam, or no, don't auto create the order? Andrew, I think we'll start with you. Jennifer answered, but I'll let you expand upon that in a little bit. Andrew, why don't we turn to you?
Well, first, the studies are uploaded through the medical records. The patient has to have an active encounter. They have to be registered. It just can't be a random person we've never seen before. So that's our first safety catch there. We also do limit studies. We do have a cap. Because early on, people would come down to a file room with 100 discs. The medical students say, "Hey, I need all these uploaded into PACS," and so we usually try to cap it around 10 studies. But overall, I think at this point in time, the physicians have gotten pretty good about it. We knock on wood, but they don't really tend to really exploit it, because storage is still taken up by these imaging, but it's all related to their care. And so we've kind of been pretty, I guess, liberal with it, and it's worked okay. We haven't been burned on it yet, and it's worked pretty well.
Yeah. Jennifer, anything else to add on that?
So if they're uploading the images from within the EHR, then it will automatically generate an order. If they're just going to upload it into like a PACS system, then it won't. So It just depends on, I guess, how they're going to be uploading it.
Awesome.
Next question. And just real quick, we the way you have to map all your internal orders. So for us, we already have pre-built outside study orders that are mapped, like that Jennifer was just talking about. Yeah. So if they're done through the EMR, that's how it's automatic.
That's awesome.
And ours says like external image, so they know it's an external image being ingested.
Right.
And I believe we will send these slides out after the fact, but this workflow, I think, walks through a little bit of an example of one of those workflows and how the orders are created, et cetera. Kind of related here, how are you all going about vetting what gets ingested? So an example, a stack of CDs arrive with a patient and family, and now your staff is faced with loading all exams or limiting to the 5 most recent. Who is making that call? What's the policy on how many exams you're ingesting into your own systems? Jennifer, why don't we start with you?
Oh, that's a good question. I don't know if we do, to be honest. From what I understand in the workflow that they're doing, they would probably ingest all of them. I don't think they have anyone really kind of monitoring that. So I'm going to take that as a follow-up and see how that's being managed, because I'm not entirely sure.
Awesome. Thank you. Andrew, what about?
It's a great question.
Yeah, that's a great question.
Yeah. Before this autofilm library, before the automated workflow, it was 10 studies. Now it's, again, like it's not, I think it's pretty open.
Yeah.
But
probably a lot better now because it is more automated. So the challenge of bringing in 10 or 20 studies is maybe not as daunting as it probably would have been historically.
Well, the turnaround was so long before that
Right.
they did feel the need to do everything all at once. But now I think that it happens like instantaneously. They're not as concerned about getting everything uploaded all at once right. At the beginning. So that might have helped out as well.
Yeah. So next question is really around, we talked about allowing patients the ability to upload their imaging. How often were you guys getting inbound questions from your patients needing help on uploading or receiving issues? And then how long did that take for that number to go down? I think this goes back to that like usability, intuitiveness component. How are you handling those patient inquiries?
For us, we handle it through our help desk, which goes right into our PACS help desk. And to be honest, it's been very little.
Mm-hmm.
I can't even think of the last time a patient called. That's remarkable. And like I said, the international medicine, these people don't even speak, probably speak English at the most of the time, and they've all figured it out. We have had no calls, virtually no calls about issues uploading. It's been very seamless. So it seems to be pretty intuitive.
That's great. Jennifer, what about at Honor Health?
Same here. It all goes through our service desk, and I haven't seen an incident ticket related to that, and I don't even remember how long. So our service desk has tip sheets on how to resolve that issue. And if a patient calls in, wanting help on their imaging, they usually call the HIM department, and they also have tip sheets on how to help the patient navigate, their patient portal and the imaging piece of it.
That's awesome. Next question is around, I think, availability and retention. I'm actually going to collapse two questions. Do you guys have a retention policy for the exams on the portal, meaning how far back is imaging available? And also, is it activated for everybody? And in other words, is it dependent on the insurance or the action? Is there any sort of contingency that drives for whom the portal is available and what is available to them? Jennifer, let's start with you.
So the imaging is available on the portal only since we went live with the integration, which was, I want to say last year or the year before. Mm-hmm. But we can send patient images, no problem. So, our overall retention policy here is an active patient plus 6 years.
Okay.
But I don't think we have anything really on the portal per se. I think that as long as the patient has imaging done, it'll be viewable there. Right. And it's for every patient. So it's not limited to insurance. So any patient who's seen at Honor Health can get on the patient portal, whether it's an app or on the website, and access their imaging.
Awesome. Andrew, anything from you?
Yeah, I mean, I think for, as far as access, it's all patients. We don't restrict by anybody. And we did upload the past 5 years. So those are available within the portal. And like Jennifer said, we can also send any older studies before that to their portal if they need them. And it's worked great. And yeah.
Awesome. And yeah, I put up a slide on the screen that sort of walks through the typical patient portal workflow. And this will also be included in the follow-up slides. We've got 1 minute left, and I want to end on this question because I think it's great. We've got a listener or an attendee who is attempting to use electronic image sharing for a pediatric trauma project. They've set up the gateways, but it's been a challenge to get providers to send imaging remotely, even when the technology is set up. It is a paradigm shift to think about sending imaging ASAP versus on a CD when the patient is getting ready to transfer. Any advice? Andrew, why don't we start with you?
Real quick, the advice I would give is just educating them on the benefits to the patient and going through this workflow. And then it's also just educating on their side, and it's a 24/7 type thing. You can't just do first shift. It's got to be all 3 shifts. You've got to identify who's going to be involved in the process every hour, every day.
Amazing. Jennifer, any final words from you?
I second that. I think emphasizing that, sending the images via the cloud is they're going to have the images before the patient arrives. If it's coming on a CD, they're going to have to wait till the patient gets here and then launch them. The cloud is so much faster and so much more efficient.
Well, I think that it is a fantastic place to end today's webinar. Jennifer and Andrew, thank you guys both so much. I feel like I could have kept talking about all of these areas for a lot longer, but I think both of your sort of statements, opinions, thoughts around and just sort of talking to us about what you've been able to accomplish at your respective organizations via integrating imaging with your EHR for the intake, the viewing, and the access piece is honestly really phenomenal. And I commend you both for all that you've done in both of those regards. Hopefully everybody that has listened in has learned something. We'll be following up with this slide deck and answering some of the additional questions that we didn't have time to get to. But I'm going to go ahead and close our webinar on that. Thank you, Jennifer. Thank you, Andrew, so much. This has been awesome. I hope everybody has a phenomenal rest of the day, and we hope to see you on another one of these webinars very soon. Bye, everybody.